This presentation will include an outline of our problem included with the problem statement, background information, application and studies of nanotechnology with regards to ovarian and breast cancers, and the significance of study or conclusion.
Nanotechnology is a broad field that is still applicable in the diagnosis and treatment of many types of cancer. Our problem focuses on nanotechnology with cancer, specifically breast and ovarian cancer. 40% of all men and women will develop cancer at some point in their lifetime. Breast cancer is the most prevalent cancer among women of all races. Ovarian cancer is the fifth most prevalent cancer among women. Our research design says that analyzing nanotechnology and its use in the treatment of breast and ovarian cancer. What is nanotechnology? Nanotechnology allows us to manipulate atoms and molecules one at a time, which is at the nanoscale level. In order to be a nanotechnology device, it must meet the following requirements. It must be man-made. Its size must be in nano, but it must be greater than 10 nanometers. The properties must be based on the nanoscopic dimensions, and its behaviors must be determined by mathematical models. It allows for the specific delivery of therapeutic or imaging agents, which reduces the clearance time, and it provides protection to active agents.
So there are various forms of nanotechnology being used and tested in the biomedical field. At the moment, there's one branch of nanocarriers, which includes liposomes, polymeric micelles, quantum dots, and dendromeres. We will discuss further in the presentation some examples of liposomes and polymeric micelles, dendromeres that are being tested on ovarian cancer cells as well as breast cancer cells. We will also discuss nano devices, which include smart release nanocontainers, which when stimulated, they release their drugs in response to physiological or external changes, such as a pH change, a temperature change, enzyme activation, ultrasound stimulation, or an application of a magnetic field. So there's also a branch of targeting nanoparticles that they specifically target biomarkers on a cancer cell. So there's passive targeting, and there's also active targeting. So passive targeting allows for enhanced permeability and retention along with direct delivery of that drug. So the cancer cell would become more permeable to this drug, so there would be a increase in drug uptake into the cancer cells. There's also active targeting. Nanoparticles, they target the cell surface receptors of the cancer cells, and so there's many differences between nanotechnology and chemotherapy that make the use of nanoparticles in cancer treatment a better option, such as the small size. The nanoparticles can be distributed throughout the body quicker. They can be taken into the cell more easily than larger drugs in chemotherapy. The nanoparticles can also target tumorous cells, so they specifically kill the cancer cells. While in chemotherapy, there's no differentiating between the healthy cells and the tumor cells, so all the tissue in the vicinity will be killed by the drug, which makes the nanoparticles just safer for the patient overall. They also are more effective because they can carry over 2,000 drug molecules to the cancer cell, while in chemotherapy it can only take up to 10 drug molecules into the cell. So it's essentially safer as well as more effective for the patient. And another aspect of its specificity is the several targeting ligands that the nanoparticle or nanocontainer can have. I previously mentioned the targeting strategies, so this would be an active strategy. of targeting the cells. So they target the biomarkers on the cancer cells. They recognize them and they bind to the receptors on the cell surface. So they will be able to more accurately filter between the healthy cell surfaces and the tumorous cells, while the chemotherapy only has one targeting ligand, which is not a very good differentiator because many receptors the healthy tissue has as well. So there is no differentiating, once again, between the healthy and the cancerous. The nanoparticles can also stay in the body longer. They have a higher circulation lifetime than chemotherapy. So since it stays in the body longer, you don't need to undergo as many treatments as chemotherapy. In chemotherapy, it gets cleaned out from the body faster, so you need to undergo multiple treatments to have basically the same effect as in nanoparticle therapy. So these differences highlight the advantage of using a nanoparticle in cancer treatment for the patient.
Ovarian cancer. Ovarian cancer is the type of cancer that happens in the ovaries of women. Women have two ovaries, and they, produce eggs that are the main source of our hormones and estrogen and such. So basically, ovarian cancer is very dangerous type of cancer because it's very hard to detect. The symptoms usually don't manifest themselves until the disease has almost run its course through the ovaries, um, and it's in its last stages. That's when you start to see the symptoms. And because of this, patients are usually given large and toxic doses of chemotherapy in an attempt to save their lives. And as we all know, this is very harmful to the body as it kills all the cells, the healthy cells as well, in an attempt to rid the body of the cancerous cells. And to make matters worse, ovarian cancer is often recurrent, meaning that the first treatment of chemotherapy usually doesn't remove all the cancer. So you'll go, and a patient will go home and come back in like a month or so, and the cancer is back. And because of that, this proves that chemotherapy is really not the answer. It's not potent enough. And we need something that is more powerful, say nanotechnology, that can remove all of the cancer from the body. Ovarian cancer treatment option number 2 is in the form of liposomes, and the drug is called pegylated liposomal doxorubicin. And the nanoparticle that is used in this drug is the liposome, and it's usually placed inside of the chemotherapeutic drug doxorubicin. And it's the liposome, the nanoparticle, it's covered in a glycol layer and it's placed inside of the drug. And this glycol layer makes the drug more susceptible to survival on the surface of the tumor. And this allows it to last longer at the tumor site. And because of this, the drug will be able to work more effectively at removing all of the tumors because it has a longer time, it has more time, and it's able to kill all of the cells. And with this nanoparticle, there's less fear of relapse once the treatment is complete because there's a better chance that you're going to kill all of the cancer cells. And it's also safer because a patient doesn't have to keep coming back for more chemotherapy because the cancer isn't recurrent anymore.
Another nanotechnology-based treatment for ovarian cancer involves the use of nanovectors of polymer minerals that serve as vehicles for drug delivery. They can be administered by injection into the veins or at the direct site of the tumor. It is stated that the primary function of polymer minerals is to protect and improve the solubility and stability of hydrophobic drugs. Hydrophobic drugs can be encased within the hydrophobic core of the polymer mineral, whereas hydrophilic chains increase the survivability of the polymer minerals in an aqueous environment by increasing aqueous solubility and allowing for drug dispersion within the tumor cells. They are effective forms of nanovectors that use passive targeting. They are in relatively early stages of development, although their use has reached clinical stages within the United States. The reason why polymer minerals can be used as nanovectors in the treatment of ovarian cancer is because the different types, including pH-sensitive and cross-linked, improve the efficacy of anti-cancer drugs while minimizing negative side effects associated with a patient's treatment. For example, pH-sensitive polymer minerals have a longer half-life and therefore are considered more effective as drug carriers while reducing a patient's weight loss. Furthermore, cross-linked polymer minerals can control the triggered release of the active therapeutic agents, despite needing further development because linkages can dissociate upon entering a patient's bloodstream.
The most commonly diagnosed cancer among women is breast cancer. It is the second leading cause of death among women. 1 in 8 women will be diagnosed with breast cancer at some point in their life. Breast cancer usually results in a surgery to remove the cancer, which sometimes results in the removal of the entire breast. Chemotherapy, radiation therapy, or hormone therapy may be used before the surgery to reduce the size of the tumor. These 3 therapies may be used after the surgery as well to remove any leftover cancerous cells that may remain. The most effective nanotechnology delivery system for breast cancer is the liposomal delivery system. There are different forms of this system still being researched by researchers for the effectiveness with respect to breast cancer. Researchers, though, have theorized that the most effective nanoparticle technology will be what is deemed a third-generation system. This is when the particles travel through 2 main stages. In the first, they will go through the circulation system, where they are nearly unnoticed by the body. Then they will travel to a targeted organ to release the drugs to the tumorous cells. This is still being developed by researchers, and part of this process is still only theorized.
Magnetic polymeric nanocontainers are an example of the previously mentioned smart release nanodevices, and they have been recently tested on breast cancer cells. So the nanocontainers are composed of a stimuli-responsive polymeric shell with magnetic nanoparticles embedded into the polymer. So these nanocontainers are made sensitive to pH and temperature changes, and they also respond to an applied magnetic field, which triggers the drug release. So the pH change occurs because the cancer cells are slightly more acidic than the healthy cells, and the polymer that is used in this study has been shown to undergo a conformational change from a random coil, so it'll be like a closed shape, to a collapsed state at the temperature close to body temperature, so roughly about 32 degrees Celsius. So the magnetic particles then generate heat when they're exposed to a specific radio frequency. So when the radio frequency is applied, and the heat is generated, it further contributes to the cellular uptake of the cytotoxic drugs. Then the magnetic field also acts as a driving force for drug delivery. So essentially the nanocontainers can be led to the tumor site using a magnet, and when it reaches that tumor site, it releases their contained drugs. So what happens is they apply the magnetic field and the radio frequency to that area, to the tumor site, and the nanocontainers that are in that area are activated to release their drugs. What happens is, in the results of this study, once the nanocontainers are compared to the free drug in the bloodstream, they have been shown to have a higher percentage of drug release over time and a higher cytotoxicity in breast cancer cells compared to the free drug. So there were less cancer cells that survived when the nanocontainers were used in the therapy, as opposed to just the free drug. This result suggests that the heat generated by the magnetic field raised the temperature of the polymer shell and triggered the release of the drug. These findings are significant when considering the benefit of the nanodevice application to the breast cancer treatment. So they're promising results that should be studied more and developed more for breast cancer.
As nanotechnology difficulties, as with anything that is in research mode, there's always room for improvement for what is being done with nanotechnology and its methods of treating various cancers. Some essential requirements are that scientists have to develop better and stronger nanomaterials that have the potential to signal for detection and for stronger effects when treating the cancers. And as we're trying to eliminate as much harm to the patients as possible, the field of nanotechnology must work to lower the toxicity of the materials and drugs used when they enter the body, as to decrease the amount of harm to the body as possible. And lastly, we have to work at making smarter nanocarriers and particles that can detect the cancer and fight the cancer more directly without harming any neighboring cells. And to do this, they need to pinpoint the correct locations of the cancers so that they can do the work more effectively.
Overall, it can be concluded that nanotechnology is a broad field. Nanotechnology has led to nanodevices that are helping with cancer treatment. The examples of nanotechnology in this presentation that are used and developed for clinical oncology, including breast cancer and ovarian cancer, prove the potential that nanotechnology has with cancer treatment. With hope, such treatment options, seen with the development of nanotechnology, will allow scientists to eventually develop more efficient and effective cancer treatments, along with a cure for cancer.